all very much for joining this talk. Very delighted to tell you all a bit about industry interference with public health policies today. I'm going to go ahead and share my screen. So today in this lecture, you will learn about commercial determinants of health, as well as the role of corporate actors in policymaking process, and some of the ways in which industry interferes with the policymaking process. So I'm going to start by giving you some basic background, some definitions of commercial determinants of health. So for example, what it is exactly. And then I'm going to take you through two case studies, one that illustrates tobacco industry tactics and the other that illustrates alcohol industry tactics. So first of all, I'm going to start with a simple question. Who is involved in the policymaking process? What do you guys think? Feel free to put it in the chat if you have any thoughts on who is involved in the policymaking process. As you guys are thinking about it, I'm just going to mention that, yes, it does differ from country to country, but generally speaking, who is involved in the policymaking process? All right, nope, I think I see one person. Government officials, wonderful, great. Any other thoughts? Public health officials, good. Okay, so let me show you my list. So policy elites, yeah, government officials, politicians, the state, non-state actors, those outside of government. So this could include public health advocates, advocacy groups, social or people's movements. So a wide variety of individuals can be involved in the policymaking process, depending on the country and how open the policymaking process is. So today we are going to talk primarily about these actors that are outside of the government. And usually those that are able to influence the policymaking process tend to be those with power, wealth, fame, as well as experts too. I'm going to start with a few definitions since we're going to talk about industry interference. Let's just first define what companies are. So companies are any entity that engages in business. A company can be a proprietorship, partnership, or in this case, corporation. And industry is a series of companies that operate in a similar business sphere, like, for example, the tobacco industry. So this comprises of the tobacco companies, and alcohol industry, which comprise of the alcohol companies. Okay, now coming back to public health. So a growing proportion of global burden of disease can be attributed to the commercialization of products such as tobacco, alcohol, and sugar-sweetened beverages that are backed by industry giants. These industry giants are often politically and economically very influential. And there's a lot of research that has found that they utilize an array of tactics to promote their products, and frequently and unfortunately to the detriment of public health. So these are some of the research paper that's out there that shows how evidence-based policies have been opposed or watered down in the battle between health and profit. So experts have coined this really concerning phenomenon as commercial determinants of health. And this is defined as strategies and approaches used by the private sector to promote products and choices that are detrimental to health. Now, since I know you all have some public health background, you're probably familiar with the epidemiological triad, which shows the interaction between hosts, agent, vector, and environment. And usually in other diseases, the vector could, for example, be a mosquito in the case of malaria. But when we are talking about commercial determinants of health, we are really talking about industries as the vector of disease. So in this example, Philip Morris International, and the agent being the products. So cigarettes, alcohol, sugar-sweetened beverage, for example. And so this figure shows the dynamics that constitute commercial determinants of health. So you see the drivers, which are demanding of growth, internationalizations of trade and capital, expanding outreach of corporation, the specific channels, marketing, supply chain, lobbying, corporate citizenship, that influences the environment, the consumer, and ultimately health. Very recently, these two authors, Lima and Glohea, they developed a framework showing how corporate practices influence health as well. So they talk about various vehicles of power that they use, including the political environment, such as lobbying, preference shaping, using knowledge environments such as funding research, legal environments, and like other tactics such as tax evasion, and how this ultimately influences macro social determinants of health, risk factors, and population health. So this all seems a bit abstract at the moment. Once I get into the case study, then you'll see some of those. How have public health professionals and advocates responded to these industry interference? So the most progress has been made in the area of tobacco control. And tobacco control, unlike the other public health issues, there is a global treaty, otherwise known as the Framework Convention for Tobacco Control. And within this treaty, there's an article called Article 5.3, which mandates all parties to act to protect public health, tobacco control public health policies from commercial and other vested interests of tobacco industry in accordance with national law. So this is a very unique and strong policy that protects tobacco control policies from industry interference. So this is, like I said, unique to tobacco because of this global treaty. And so some of the tactics that the tobacco industry uses that we've seen through the various studies include, for example, challenging science, trying to create a positive image through being involved in corporate social responsibility activities, manipulating economics, such as participating in illicit trade, influencing government policymaking and implementation through, as I mentioned before, lobbying, and mounting legal challenges to threaten government officials, for example, to not pass specific policies. So, and some of the tactics that are commonly used by tobacco control advocates to counter industry interference include producing and disseminating scientific evidence. They try to sensitize decision makers to cultivate allies. They also expose industry tactics. So there's various researchers and watchdog groups who monitor tobacco industry interference and expose this in order to increase awareness. The advocates often also use media advocacy, and they forge transnational collaboration. So they work with advocates in other countries to share some of the tactics that they've used in their country that has been successful, so they are also able to overcome industry interference. So one watchdog group, if you're interested in this topic, I would encourage you to check them out. They're called STOP for short, but the full name is Stopping Tobacco Organizations and Products. This is funded by Bloomberg Philanthropy. And their mission is to expose and counter industry behavior that undermines public health. And they do this through monitoring, research, and reporting. They try to hold the tobacco industry accountable and support efforts around the world to address industry interference and policy. So recently, for example, they have looked at what are considered front groups for the industry. So these are organizations that do not appear to have any ties with the industry, but they're actually funded by the industry and they act on behalf of the industry. So STOP has actually, monitored and digged into these various organizations and highlight who these organizations are, so people are aware that these are industry front groups. So if you're interested in that, I would encourage you to check out their website. And so, okay, just wanted to give everyone a brief background and some basic definitions before we jump into two case study. But before I do, I just wanted to pause here and see if there's any questions about the definitions.
Students, if you have any questions, feel free to use the raise hand reaction in the Zoom call or type it in the chat.
Okay, so while you're thinking of questions, or maybe you don't have questions at the moment, I will go ahead and start talking about this first case study so that you can get a better sense of what these tactics are and how industry interferes with policymaking. So this first case study is about the battle for Philippines syntax reform in 2012. So I'm going to start by giving you a bit of background on the Philippines. So Philippines is a very interesting country. It's a lower middle income country located within the WHO Western Pacific region. And both alcohol and tobacco use are major public health problems in the Philippines. They both impose a substantial health and economic burden on the country. However, something very significant happened in 2012, and that is the syntax reform law was passed and it was signed into law by the president at the time. And why do I say this is very significant? And this is because the syntax reform law is a departure from the historical tobacco and alcohol tax policies in the country. It did 4 specific things. So it indexed tobacco and alcohol taxes to inflation to make sure that these products are not so affordable. For tobacco, it removed classification freeze and removed tiers. So essentially, they ensured that the taxes are more aligned with international evidence-based best practice. And for alcohol, they ensured that the tax was WTO compliant. And very, very importantly, the revenues generated from these taxes were earmarked for health. So for example, in the first year that the syntax was implemented, more than 1.2 billion US dollars was raised, and this allowed the country to deliver health services to an additional 45 million Filipinos. So this is a huge victory for public health. And so just also as a side note here, syntax refers to taxes on SIM products. It's usually a term that we don't use in the field of tobacco and alcohol control anymore because it has this negative connotation. Usually we say health taxes, but in the context of Philippines, they use the term syntax, and that's why I continue to use this term. Okay, so we wanted to understand, how the Philippines managed to adopt and implement this very significant policy. And we also wanted to understand how the industry acted during this process. And so we did this research and we interviewed government officials, multilateral organizations such as World Bank and the World Health Organization, the non-governmental organizations involved. We also reached out to tobacco industry to see if they had anything to say about this. Almost all of them declined except for one. And we also reached out to academics who were intimately involved in the passage of the policy. So in addition to the interviews, we also looked at the various relevant documents. Okay, and so that was our study method, and I'm going to tell you a bit about what happened and how this law was passed and what were some of the tactics that the industry used to influence this process. So first of all, it all began in 2010 with the election of Aquino III. It's actually quite timely that we're talking about this because, well, not timely, but a good time to commemorate Aquino because he actually passed away on Thursday, today. And so this is actually one of his great achievements as the president of the Philippines. So Aquino III became the Philippines' 15th president. And when he came into office, his priorities were to increase efficiencies in tax collection. And also he wanted to achieve universal health care. And he wanted to do this by accelerating the PhilHealth enrollment for poor Filipinos. So this idea of using syntax to fund universal healthcare started emerging in different pockets of the Philippine society. And these advocates, these proponents, advocates of syntax, started forming what eventually becomes a strategic intersectoral coalition. So it all started with two key NGOs, the Framework Convention Alliance Philippines, which is a tobacco control group, and Action for Economic Reform, which is an economic think tank. So these were the two NGOs that started to talk about using the syntax to fund healthcare. And they got together because, well, one of the reasons was because a staff from FCAP, Framework Convention Alliance Philippines, actually started a job at AER, Action for Economic Reform, and suggested the idea of the two coming together to work together on this. So small group of civil society organization, started planning this. And at the same time, or actually, let me read this quote first from one of the key informants. So actually, before it all happened, there was this tiny group. It's a small, really small group composed of advocates. Okay, most of them are from academia and advocates, and this group was spearheaded by both FCAP and the Action on Economic Reform. So this was the civil society side. On the government side, there were also champions in the Department of Health and champions in the Department of Finance that emerged. And these proponents of the syntax started capitalizing on their own network to mobilize other groups, such as medical society. So the FCAP, for example, is comprised of many medical doctors, so they had links to medical societies in the Philippines. So they started mobilizing them to support the syntax. Similarly, AER mobilized the youth. So these are economists in universities, for example, and also victims groups. So those that suffer tobacco use related diseases, they were also mobilized. And the civil society groups and the champions within government, they also met frequently to align strategies. They actually call it a war room in which they, try to figure out what steps to take next to defeat industry interference and also to convince decision makers to pass the syntax reform. And so what's really unique about this intersectoral collaboration coalition is that it brought together the health and economic sector for the first time. And this is huge because they framed the syntax as a health measure rather than a revenue generating measure. The history of this is that before Aquino became president, before this idea of syntax emerged, the champions within the Department of Finance have been trying really hard to increase tobacco taxes because it will generate revenue. However, they kept framing it as a revenue generating measure, and that didn't really gain much traction. And so what's really unique about this is that they reframed it as a health measure, and they were able to get groups from both the health and economic sector coming together to work together. So the resulting coalition, so I just explained how it started. The resulting coalitions include proponents such as Office of the President, as I said, Department of Finance and Health, some legislators, some local government executive, CSOs, academics, medical societies, some lawyers, and some journalists. On the other hand, there were opponents of the sin tax reform. And these were opponents, so there were those who opposed the tax in its entirety, and there were those who opposed specific components. So opponents included tobacco industry, industry associations, industry front groups, also some government officials, some legislators, some academics, journalists, etc. Other opponents included alcohol industry that was opposed to just the alcohol component of the tax, American Chamber of Commerce. Anyone can guess why American Chamber of Commerce was interested in opposing this reform? Have any thoughts? Put it in the chat. And what's interesting that I will note here is that British American Tobacco was actually for the tax, and actually try to approach proponents to see if they would collaborate. But the proponents did not want to be involved with industry. The reason why British American Tobacco was pro sin tax is because the previous tax made it very difficult for new players, those that were not in the Philippine markets before a certain period of time, to enter the market because they couldn't be competitive. So I see a comment in the chat, but let me just see if I could bring up the, oops. Okay, here we go. So lobbyists, yes, so great point. So I'm assuming you are talking about the American Chamber of Commerce, right? Yep, because the tobacco companies in the Philippines, they're American. Yeah, so American Chamber of Commerce got involved. And I'll tell you in a little bit what they actually did. Okay, so now that we know the two big coalitions, I'm going to tell you a bit about the legislative process in the Philippines. So in the Philippines, if you wanted to get a tax bill passed, you have to first go through the House of Representatives, then through the Senate. So in the Senate, you can approve the bill that was passed by the House, or you can propose amendments, okay? And then the differences between the House bill and the Senate bill are then reconciled in the Buycam, Bicameral Conference Committee. Before then it's transmitted to the president for signature. So during this process, and I'll talk about each one in a bit, but I just wanted to mention that throughout the process, proponents, they were strategizing, talking to each other. They used several strategies. So this included lobbying, such as political mapping. And they told us that they really went online and dug up everything about these different politicians just to see how they can convince them to support the reform. And they used a traffic light method where those that support the reform were green. So those were the proponents, yellow were fence sitters, and then you have the proponents colored in red who are the staunch opponents. So they use this method to identify champions. They also visited the parliament member or the congressmen and women using door-to-door outreach. They attended and testified at congressional hearings, and they capitalized on their existing networks. They used media advocacy, and they also participated in demonstrations. So opponents also used an array of strategies during this time. So they also did lobbying. They went door to door as well. They provided perks. And as I mentioned, they got letters and calls from the US Chamber of Commerce. So the government officials got letters and calls from the US Chamber of Commerce telling the Philippine government officials not to pass the sin tax reform law. The opponents, industry and their affiliates, also engaged in media advocacy, media interference, and demonstrations, as you can see in the picture here. So, as I mentioned, the first step was to get it through the House. So traditionally, the House is, a lot of the House of Representatives, the congressmen and women, they were controlled by the tobacco industry. But thankfully, the new chair that was elected did not have ties with the industry. And so as this government actor said, the first hurdle was to get it out of the Ways and Means Committee of the House, which was traditionally controlled by the tobacco industry. I mean, the majority of them are members, but we were lucky that the chairman was a new chairman. He was underestimated by people, but also a very good strategist. And so to get it through the House, the advocates really compromised. They agreed to 2 tiers of tobacco tax. And I didn't explain this earlier, but it gets a bit technical here in case you're interested. So the international best practice is to have a uniform tiered tax. So all products are taxed the same, because the concern is if you tax some products more than others, then some tobacco products are still affordable and people would downshift and just basically not smoke the expensive ones and smoke the cheaper ones. So ideally, there is a uniform tax. But to get it out of the House, they compromised. They agreed to 2 tiers, and they had lower taxes for alcohol compared to tobacco because they didn't want the industries to join forces. And the advocates thought that they could work on a better version of the law in the Senate, because Senate, you can propose amendments and then it has to be reconciled in the Buycam. Okay. So then they got it through the House with those compromises, and then comes Senate. So unfortunately, the chair of the Ways and Means Committee at the time, Ralph Recto, he decided to file a bill that resembled Philip Morris Tobacco Company's stance. So advocates were really clever. They started calling for his resignation and named the bill the Recto-Morris bill. And you can see on your left, some of the demonstrations that they were involved in. They brought caskets out, they pushed for his resignation. And this all got up to the year of the president. And he also exercises political muscle. That, along with the protests and demonstrations, Recto actually did resign in October 15, 2012. And a tobacco control proponent actually took his place. And so advocates were lucky. They got the Senate version of the bill passed that were more aligned with what they wanted, which was 2 tiers for 5 years. And then by 2017, it shifts to a unitary tax system. So then comes the Buycam. This is, as I mentioned, when the House and Senate versions of the bill are reconciled. The interesting thing about this is that it's a closed door meeting, so people don't really know what happens. And this is what's interesting if you are also interested in studying policy processes in different countries. You'll realize that in many countries, the policy process is actually quite opaque, and people are not aware of what happens in this process. So as this academic said, it was a closed door meeting, so there's no accountability, like they could actually vote yes or no or insert certain statements into the bill, and no one will know who did what and who voted. This is really concerning. But the proponents credited one of the government champions for pushing the sin tax bill through, and the committee signed the report on December 11, 2012. And finally, it gets to Aquino, the president, who signs the bill into law. And he said during the signing that many thought it was impossible to pass the sin tax reform bill. The enemy is strong, loud, organized, and has deep pockets. But as we have proven time and time again, nothing is impossible with the Filipino nation rowing in one direction, heart in the right place, and ready to stand up for its principles. So that was the case from the Philippines. I want to tell you a little bit more about alcohol industry tactics, but before I move on, I want to pause here again and see if there are any specific questions about this case. And since I don't see any hands or comments right now, I'm going to continue. Okay, so this other case is about alcohol, and specifically alcohol industry's involvement in road safety around the world. And so maybe let me just start by giving you some background of why we should be thinking about this. So first of all, road traffic injuries are a major public health problem, something that a lot of people actually don't realize. It is actually the leading cause of death among children aged 5 to 14 and among young adults aged 15 to 29 around the world. So there's many risk factors for road traffic injuries, and one of them is drinking and driving. And this is because alcohol impairment can lead to, for example, poor judgment, increased reaction time, lower vigilance, decreased abilities to see well, all critical to navigate a vehicle, right? Alcohol impairment is also associated with other risky behaviors. In the context of road safety, it would, for example, be speeding or not wearing your seatbelt. And so drinking, driving, major risk factor for road traffic fatalities. So this is from the Global Status Report on Road Safety. And you'll see that the countries colored in green have drink driving laws that are consistent with international best practice. Those in orange are ones that are partial, like partially meet best practice, but not completely. And those in red, surprisingly, are countries that do not have drink driving laws or laws based on blood alcohol concentration. So you see that not a lot of countries have laws that meet best practices. And there are many reasons for this. And one we suspect is due to alcohol industry interference. And so for this study, our purpose was to really get an understanding of how the alcohol industry has been involved in road safety policies and programs around the world. And we also wanted to understand the responses of the public health and road safety communities to this involvement. Like, what have they done? Are they doing similar things as the tobacco control community, for example? And so in order to answer this question, we did a lit review where we searched many databases, as well as alcohol industry watchdog websites, alcohol industry sponsored websites, and we also interviewed experts who have an extensive knowledge of the involvement of the alcohol industry in road safety policies and programs. And so in terms of our data analysis, we used inductive and deductive coding and also triangulation between the two different sources. We found 102 relevant articles that we then included in this study. And in terms of the experts, this is just a breakdown of their field as well as location. You'll see that most of them are from academia, but we also interviewed NGOs that accept funding from the industry and those that don't. And we also reached out to the alcohol companies and what's called social aspect public relations organizations. These are organizations funded by the alcohol industry. And we tried to reach out to experts around the world. Okay, so here are some of our results. So you'll see that the alcohol industry is involved in road safety in these 5 specific ways. And I'll talk about each of them. So coalition management, and then at the top, information management, information production, direct involvement in policymaking, implementation of interventions. They're also involved in issue framing, which I will also talk about in a little bit. So what do I mean by coalition management? So the alcohol industry partners with road safety stakeholders. They also set up what I just mentioned, SAPROs and front groups. And so these are some examples. And so this shows so basically we found that these alcohol industries, they conduct, for example, drink driving assessment in countries together with various governments. And this public health academic says they're not bringing stakeholders together to solve a problem. They're bringing stakeholders together to make themselves look good. So, so I just got a question. How effective can NGO activist efforts be if they are not legally adopted? Do you mean if there's no global treaty? Or or do you mean like if there isn't a law in place? So let me know. Okay, so if there is no law, so no BAC law, right? For example. So yes, so we do see when a law does not exist, a lot of sometimes for the NGO or activists, their goal would be to get that law enacted. And they use various strategies to pressure the government to do that. And they can be effective or not effective depending on various factors, the tactics that they use, the context, and how strong the opposition is. Hope that answered your question, and let me know if you have a follow-up question. Okay, so I just talked about coalition management. Let me just like navigating different things on the screen. Okay, so now I will talk about how they are involved in the implementation of interventions. So you've probably seen a lot of these interventions actually in your daily life, you know, these marketing campaigns that tell you to drink responsibly. So alcohol industry has been involved in funding, supplying, and implementing interventions. But a lot of these strategies, which I'll tell you in a second, I'll show you a research study in a second, are not evidence-based. So this public health academic said strategies that the alcohol industry uses are mostly educational programs. To me, they are really programs that draw attention away from changing the availability of alcohol, changing the supply of alcohol, changing access to alcohol in the community. I really think of them as distraction tactics, techniques. So just to give you a bit of background, the international best practices for alcohol control are population level measures, which is about taxation, taxing alcohol, reducing availability, banning, for example, marketing and sponsorship. These are interventions that are actually ones that threatens the profitability of the alcohol companies. And the suspicion is, or a lot of the experts say that the alcohol industry do not support these type of population level evidence-based measures. Instead, they focus on educational programs that have limited or no evidence base to make themselves seem like they're being good corporate citizens. And so one research that backs that is this research conducted by Esser and colleagues. And if you're interested, this is a really good article. Basically, what they did was they evaluated 266 alcohol industry sponsored global initiatives to reduce drink driving. And they found that the majority of these initiatives are inconsistent with evidence-based public health recommendations. Only 2 out of the 266 interventions were. So that's 0.08%. Okay, so we talked about coalition management, implementation of interventions. The alcohol industry is also involved in policy making. And as this public health academic said, they wine and dine state legislators, and they also contribute to their campaigns. So alcohol industry is also involved in information production, which we define as funding research directly or recruiting scientists, as well as information management. So this, we mean disseminating industry-sponsored information or evidence through mass media and other formats, and also trying to maintain industry reputation by trying to characterize themselves as good corporate citizens. And this is important because this could give them a strategic advantage in terms of being at the table with policymakers or being able to market their products. And so this is also a really good article that is a systematic review of alcohol industry corporate social responsibility initiatives and harmful drinking. So not just drinking and driving, harmful drinking in general. And they conclude that a lot of the alcohol industry's CSR initiatives do not contribute to the attainment of the goal of reducing harmful drinking. So those are some of the ways in which the alcohol industry is involved in road safety. Another way is also they frame the issue. So they talk about alcohol misuse as an issue of personal responsibility. I'm sure you've heard this quite a bit. They talk about how the majority of drinkers are moderate and responsible, and that harms are caused by an aberrant minority. And the moderate majority should not be swept up in policies and interventions which are poorly targeted. Remember what I said about how most of the international evidence-based alcohol control policies are population level. And so using this argument that most of the people are moderate drinkers, so you shouldn't penalize them by increasing taxes and et cetera. That's what the alcohol industry is trying to do. So they're trying to shift that argument to saying that most people are moderate drinkers, so we shouldn't adopt these population-wide policies. The alcohol industry also talks about how they're a legitimate stakeholder in developing alcohol policies, so they should be involved. They talk about at times that alcohol misuse is a risk factor for drinking and driving, but alcohol use is otherwise not problematic. In other words, they acknowledge that drinking and driving is an issue, but they often do not acknowledge the other issues caused by alcohol. For road safety, some of the alcohol companies have directed the attention to drowsy and drug driving, saying that those are as dangerous as drinking and driving. Okay, so those are the ways that the alcohol industry has been involved in road safety. Now we're curious to see how the road safety and public health communities react to this, right? You would think that there would be an outcry, but unfortunately, we found that the community is quite fragmented, particularly as it relates to whether or not they should receive funding from the alcohol industry and whether or not they should partner with the industry. So some groups, so the reason why I separate the public health and road safety communities into two communities is because you would think that they overlap, but it's some of the road safety community members kind of decouple the issue from public health, saying that their focus is on road safety specifically and everything else goes beyond their organization's mandates, and that there are more approximate steps to tackling road safety than focusing on population level interventions. So I'll just also briefly talk a little bit about funding. So some of the NGOs that receive funding from the alcohol industry say that they don't have any, so that they are able to accept the funding and they can remain independent. But those that are opposed to it say that, you know, you are influenced, even if subconsciously, when you receive funding from the industry. So some conclusions from this case, the alcohol industry has been involved in road safety through various ways. Coalition management, for example, implementation of interventions, information production, information management, and direct involvement in policy making. They're also involved in framing the issue. Our study also shed light on the lack of cohesion within amongst the public health and road safety communities. They are not in agreement on whether or not they should accept funding from the alcohol industry or partner with the alcohol industry. And this is very problematic for the movement because if you look at like the political science literature, you see that cohesiveness within a policy community is a key factor for political prioritization of an issue. without which meaningful policy change may not take place. So that is the alcohol case. And I do have a question. Do you guys see any similarities or differences between the two cases that I just talked about? So one difference I'll point out, and I know that one is about a specific country, one is worldwide, so it could be a little bit difficult to compare. But so one of the differences is what I just mentioned, right? This need for cohesion. So in the case of the syntax, you saw that all these different actors got together and they met in a war room, they called, to align strategies. And this was really important because they wanted to make sure that their strategies complemented each other and that they were rallying in one voice. And so this is part of the reason why they were successful. And if you read other case studies on successful passage of policies, you'll also see cohesiveness as a very key ingredient to success. And so this is kind of one of the big issues, I would say, for the alcohol control community, is that there is quite a bit of fragmentation, and they really need to rally in one voice to actually make meaningful policy change. So that's one of the key differences. Okay, I see a comment in the chat. In both cases, the industry, so Melanie said, in both cases, industry manipulates evidence from research. Yes, this is true. So in both cases, in the syntax, for example, the alcohol industry was also doing models to show, how much revenue the government would get if they actually increased taxes. They talked about how taxes are regressive and they won't make any more money as a result of this increase in tax. So they were very much using their research to support their arguments. And you're right, in the case of alcohol too, we see that alcohol industry funds and is involved in research. Great, okay. So I will just open this up for Q&A. Maybe I'll hand it over to you, Siam, to moderate.
Sure, thank you so much for the excellent presentation, Dr. Hoe. Yes, we'll shift to our Q&A now. We have about 10 minutes to take questions. Students, if you do have a question, please use the raise hand function, and then I'll call on you based off of the order that you appear on my Zoom. And then before you ask a question, just do let Dr. Hoe know where you're from and what grade you're in. And we can also take questions in the chat.
Yeah, hello, my name is Melanie. I am a rising senior from Fremont, California, and I'm calling from Taiwan right now. And I had a question about the industries that I find it really interesting that these industries, they promote these products knowing that it's detrimental to our health. And I was wondering if there's anything that's being done to decrease the production of processed meats, because I know that like tobacco, it's a class 1 carcinogen. So do you know if there's any policies that's currently being enacted to like prevent the production and promotion of the consumption of processed meats?
Of what? Sorry, the last thing you said?
I think she's saying processed meats.
Oh, processed meat. Okay. Great question, Melanie. And I'm also originally from Taiwan, so that's so great. So I think, all right, this is a very interesting topic because a lot of work has been done in the area of tobacco control and exposing industry tactics, etc. And recently, there's been this interest in ultra-processed food and also sugar-sweetened beverage. And so a lot of the advocates are looking at what has been done in the area of tobacco control to also address some of the industry interference there and to adopt similar policies. I think what is difficult with banning processed meat and issues in the food sector is that it's a little bit more vague. because the food industry, some of them, they produce healthy food and also unhealthy food. But versus tobacco, it's a bit more black and white, where tobacco products are essentially really not needed, whereas food is something that is needed, right? And so I think the food, that sector, they're kind of struggling a bit to kind of address these type of issues. I hope that answers your question.
Yeah, I am.
There we go.
Hi, I'm Jada Yang from Los Angeles, California, and I'm a rising sophomore. So I think in one of the case studies, there was something about advocacy groups making change with collaboration, like with the government. And I was wondering, as high school students, how we could also make a change outside of social media and other platforms.
Great question. So I think as youth, you have a lot of power, because these products affect youth, and oftentimes these industry target youth. And I'm sure you've seen, even like with e-cigarettes, for example, they claim that they're not targeting youth, but if you see the ads, it's pretty much targeted at youth. And so I think youth voices is important. And I think if you were able to contact your representative, for example, or get in touch with local NGOs who are working on the issues, that would be very meaningful. Yeah. We see, so in the Philippines, youth groups were involved and they were very, very powerful. So these were, so the youth groups there were students at the universities, and they were coalesced around, so they were essentially a lot of students studying economics, and they had like fairs at schools to increase awareness of fellow students. And I think similarly in high school, that could be something that's done. And in fact, there's a group called Campaign for Tobacco-Free Kids. And each year they award, I think those in high school or even younger, they award those activists, young activists who are making change. So you can also go on their website to see some of the things that these youth have done.
Looks like we have a question in the chat from Alex. They ask, what are some of the differences between cigarettes and vape pens when it comes to how companies advertise them and how they're opposed to taxes and laws made to decrease revenues?
This is a great question. And I will say that so far from what we have seen, the tactics are very similar, even though a lot of the vape companies talk about how they're very different, but a lot of the tactics that they use are very similar. I also have a question from Nita. So I hope I'm pronouncing your name correctly. Nitha, you asked, when NGOs are in a conflict on industry policies, how do they come to conclusion on how to progress? Now, this is also a really interesting question, because oftentimes public health and industry policies are at a direct conflict with each other. And so oftentimes they do not come together to resolve, because the public health advocates are pushing for evidence-based public health policies that protect the health of the population. And so if the industry's policy do not protect public health and are at the detriment of public health, then advocates do oppose that. Yeah.
My name's Alessandra. I'm a rising sophomore from Seattle, Washington. And my question was, I saw in your presentation that you had a map about best policies, practices for road safety as it relates to drunk driving. And I was wondering what some of these practices that should be implemented are, and what is preventing the United States, for example, from implementing these policies in the best category. Is that the industry influence or the motivations of the politicians themselves?
Excellent question. Okay, so for a drink driving law to be consistent with international practice, you have to have a blood alcohol concentration of 0.05. That's the limit for the general population. and for novice and young drivers, 0.02 blood alcohol concentration. So in the US, as you know, probably the limit is actually 0.08, so it's much higher than global best practices. The only state that has the policy similar to or consistent with international best practice is Utah, and that is the only state that has recently passed this law. There are other states that have tried, like California, for example, and there are many factors that influence these policies from passing, but one of them is industry interference. And there are studies actually that talk about how industry interfered with the US actually decreasing. So it used to be even higher than 0.08. So when the US tried to decrease it to 0.08, there was also a lot of industry pushback. So there's quite a bit of study on that too. And so yes, lots of different factors, including industry interference.